Assalamualaikum warahmatullahi wabarakatuh. Good morning, ladies and gentlemen. Distinguished all the lecturer and student of Nursing Faculty Narasuan University.
The Honorable, the Dean of Nursing and Midwifery Faculty, Universitas Nahdlatul Ulama Surabaya, Madam Kamidah, Master of Nursing.
The Honorable, the Vice Dean of Nursing and Midwifery Faculty, Universitas Nahdlatul Ulama Surabaya, Madam Nurul Hamaria, Master of Health.
All Head of Study Programs,
Secretary of Study Programs,
and all lecturers and students of Nursing and Midwifery Faculty, Universitas Nahdlatul Ulama Surabaya.
All praises belong to God Allah Subhanahu wa Ta'ala, who has given us mercy and blessing, so we can attend and gather in this event without any problem and obstacles.
May salawat and salam always be given to our Prophet Muhammad Sallallahu Alaihi Wasallam, who has guided us from the darkness to the brightness in this Islam religion.
Welcome to International Guest Lecture by the theme Prevention of Risky Sexual Behavior in Adolescents. Held by Nursing and Midwifery Faculty, Universitas Nahdlatul Ulama Surabaya. Ladies and gentlemen, before we start this agenda today, allow me introduce ourselves. I'm Muhazirin Khairoy, vocational student of nursing at my partner.
I am Putri Narasya Jamila, vocational student of midwifery. As the host for today's event, ladies and gentlemen, to start this event, allow me to read agenda today. First, opening.
Second, singing the national anthem Indonesia and Thailand, Mar Sumanul Watan, and hymn of UNUSA.
Third, remarks from the Dean, Nursing and Midwifery Faculty.
The fourth is praying.
The fifth, international guest lecture, and fourth by discussion.
The sixth, awarding certificate to all speakers.
And the last is closing.
Ladies and gentlemen, the first agenda is opening. Let's open the event today by praying. Thank you.
Next agenda is singing national anthem of Indonesia and Thailand, March Loton, and hymn of UNUSA. All participants, please stand up.
Jadi pandu สงบแต่ถึงรบไม่กล้าเอกราชจะไม่ให้ใครคุมทีสละเลือดทุกอย่างเป็นชาติทะเลถ้าเดินประเทศชาติไทยก็เวทีชัยชโย
ข
rahmatan lil alamin. Semoga ridha Allah tuh urusan. Semoga ridha Allah tuh urusan.
All participants might have a seat.
Ladies and gentlemen, the next agenda is remark from the Dean of Nursing and Midwifery Faculty, Universitas Nahdlatul Ulama Surabaya, the Honorable Madam Hamidah, Master of Nursing. Time is yours.
Assalamualaikum warahmatullahi wabarakatuh. Good morning, ladies and gentlemen. Sawadika. The Honorable guest speaker today, guest lecturer among other, the Honorable Assistant Professor Sanglar Ponlok, the Honorable Assistant Professor Dr. Wuraman, the Honorable Assistant Professor Dr. Jirarat, the Honorable Dr. R. Haryatul Afia, the Honorable Vice Dean of Nursing and Midwifery Faculty, all the lecturers of Nursing and Midwifery Faculty, and the dear all participants, committee, and invite guests. Alhamdulillahirabbil alamin, praise to Allah subhanahu wa ta'ala. By His willing today we can get together in this auditorium Tower Unusa to even on guest lecture in good condition. Peace and blessing are also prayed to our Prophet Muhammad sallallahu alaihi wasallam, who has guided us from the darkness era to the brightness it is Islam religious. Welcome in the event guest lecture, Prevention of Risky Sexual Behavior in Adolescent, to all study Nursing University and Universitas Nahdlatul Ulama Surabaya. The objective of this guest lecture is to provide us with a unique opportunity to dive into the deep. As we explore the subject matter, we will gain valued insight, challenge our existing perception, and broaden our horizon. As the Dean, I would also like to thank you very much, Lector Nursing University, the Student Nursing University Organizing Committee, volunteer, and everyone involved in make the event possible. Your hard work and dedication are truly commendable, and we are grateful for your effort in creating the platform from intellectual exchange. Without further ado, let's welcome our esteemed guest speaker. Thank you once again for Nursing University, Thailand, for gracing us with your presence, and we eagerly look forward to your enlightening work. Welcome to Universitas Nahdlatul Ulama Surabaya for Nursing University, Thailand. Khobkhun kha. Sawadika. Assalamualaikum warahmatullahi wabarakatuh.
Thank you for the nice remarks.
Next agenda is praying that we be led by the Honorable Madam Siti Maimunah, Master of Education. Time is yours.
Assalamualaikum warahmatullahi wabarakatuh. Bismillahirrahmanirrahim. حمدا شاكر حمدا ناعم حمدا يوافي نعمه ويكافئ مزيده يا ربنا لك الحمد لجلالك وعظيم سلطانك اللهم صل على سيدنا محمد الفاتح لما أغلق والخاتم لما سبق ناصر الحق بالحق والهادي إلى صراطك المستقيم وعلى آله وصحبه حق قدره ومقدار العظيم اللهم أنزل الرحمة والنعمة والبركة على الجامع الحاضرين في جامعة نهضة العلماء سورابaya اللهم اجعل جمعنا هذه الجامعة نهضة العلماء سورابaya جامعا مباركا طيبة مشهورة في بلدنا إندونيسيا وفي الدور آخر اللهم أعنا على ذكرك وشكرك وحسن عبادتك اللهم اجعلنا وأولادنا وطالباتنا من أهل العلم وأهل الخير ولا تجعلنا وإياهم من أهل الشر والضير اللهم أعنا على ذكرك وشكرك وحسن عبادتك ربنا ظلمنا أنفسنا وإن لم تغفر لنا وترحمنا لنكونن من الخاسرين ربنا آتنا في الدنيا حسنة وفي الآخرة حسنة وقنا عذاب النار وأدخلنا الجنة مع الأبرار برحمتك يا عزيز يا غفار وصلى الله على سيدنا محمد سبحان ربك رب العزة عما يصفون وسلام على المرسلين والحمد لله رب العالمين. Thank you so much. Assalamualaikum warahmatullahi wabarakatuh.
Thank you very much for our event today. We don't run without any obstacles.
Ladies and gentlemen, now we are coming to the main agenda, that is International Guest Lecture by the theme Prevention of Risky Sexual Behavior in Adolescents. And we will call Madam Esti Puji Rahayu, Master of Health, to lead this lecture. Madam Esti Puji Rahayu is lecturer in midwifery study programs. The Honorable Madam Esti Puji Rahayu, time is yours.
Okay, thank you Mila and Roy for the time. Assalamualaikum warahmatullahi wabarakatuh. The Honorable Ms. Hamida Eskopners, as a Dean of Nursing and Midwifery Faculty of Universitas Nahdlatul Ulama Surabaya. The Honorable Ms. Nurul Kamariah Eskopners MKes, as a Vice Dean of Nursing and Midwifery Faculty of Universitas Nahdlatul Ulama Surabaya, and all lecturer and all participants from Nursing and Midwifery Faculty Universitas Nahdlatul Ulama Surabaya. I am Esti Puji Rahayu, the lecturer of Midwifery Diploma, Nursing at Midwifery Faculty of UNUSA, as a moderator today. I will lead this guest lecture session with the theme Prevention of Risky Sexual Behavior in Adolescents. Before we start, let's invite the great speaker today from Naresuan University and Universitas Nahdlatul Ulama Surabaya. Please welcome Assistant Professor Dr. Sangla Polnok from Naresuan University. And the second, Assistant Professor Dr. Urawan Taipwarum from Naresuan University. And then the third speaker is Assistant Professor Dr. Jirarat Ruetrakul from Naresuan University. And the last, Dr. Karyatul Afia from Universitas Nahdlatul Ulama Surabaya. Thank you. How about your day? Have a great day today? Yeah. It's fifth day in Surabaya. Yes, from Sunday until now, fifth day. Yes, 5 day. Wow, your impression in Surabaya? Hot city or busy city, traffic city?
Actually, I love the kindness of the people here. Always smile and always help us to living here. And a lot of good and delicious food here that we never taste of it. And we have a lot in a packet, big packet every day. Thank you.
I think I have many experience in here, and all of people is very nice, and I think a good time to be here. Okay, thank you.
You must hear again next time.
I think this is for me is the twice, the second time for me here in Surabaya. Just thinking about 10 years ago, used to stay here, but not long, only 1 day, 1 night. That is the same, but pretty cold. I like many things here. Food, that's okay, pretty close. But I have a lot of chicken because I did not eat some beef. No beef.
Not eat beef.
No beef. That's why it's too difficult to find some food, only chicken, bebek. Ayam like
Bebek,
that, right?
yes, bebek.
Right. That's okay, but everything okay. The weather, the food, and the people, very good.
Okay, thank you for the impression, good impression.
No question for me.
Okay. Before we start this session, I will explain the rule of this session. The session is divided into 2 parts. First part is material presentation, and then the second part is discussion. The presentation session with the panel discussion. Each speaker have 15 minutes to speak to explain the material. Are you agree with this rule? Yes. Okay. The first speaker is Dr. Sangla, Assistant Professor Dr. Sangla Polnok from Naresuan University. Before it, I will read the curriculum vitae. Prof. Sangla Polnok, PhD Nursing Science in St. Paul University, Philippines at 2019, concentration in adult nursing, and the master passed in medical surgical nursing, Chiang Mai University at 1990, and then concentration in medical surgical nursing, and the bachelor degree, she had passed at nursing at midwifery at 1985. The teaching experience, she have instructor, Faculty of Nursing, Naresuan University, Thailand, from 1985 until 2019, until now. Course, adult health nursing and fundamental of nursing. Okay, Ms. Sanglar, 15 minutes for you to explain the material. Time is yours.
So I'm sit here. Or there.
Okay, they're okay with this microphone, it's okay.
มันจะเห็นได้ไงอะ I cannot see the skin. How can I see the skin? The material.
The material?
Spiritual caring. There. First, go there. Okay, Okay. Oh, I have this one also. Okay. Today, the topic of this lecture is not related to the adolescents, but it's a very important one about the spiritual caring behavior in nursing. Sometimes we need to know what is our spiritual caring behavior. Next slide, please. First of all, we have to know about the caring, what it is. Caring is the behavior of giving holistic assistance to individuals and is essential part of everyday nursing practice. And Watson's caring theory, that is, I use it for my dissertation, promotes a holistic approach to patient care. Next slide. And the current times, nurses apply the holistic principles to approach and provide comprehensive nursing care of the whole client, which emphasize the need to consider the clients in terms of physical, psychological, social, and spiritual care, and in the person's holistic related to the environment. Next slide, please. Then we will scrutinize on the spiritual care. This is one part of the caring. First of all, we have to know about the concept of spirituality or spiritual care. Spirituality is a consider of a fundamental aspect of nursing practice, and is great important to the art and science of nursing. We are nurse, we have art and science in ourselves, right? This concept of nurse. And spiritual caring behaviors are tailored to the recipient's need. So we explore the recipient's need first, and then we give them the spiritual care. Next slide, please. Wait, come back. For the spiritual needs, they have many, we can divide the spiritual needs in many ways. But for this one, for example, the first of spiritual needs, the first is sense of meaning and purpose. When we do something, we will have the meaning in our life that what we want to do, and we have the purpose to do. Like today, I come here, I propose to explain about spiritual caring to the other. And for the second, achievement motivation, we need motivation to ourselves to achievement. Everything we done now, we want to achieve something. Like me, I want to achieve in my career. So I need to have the motivation of myself. And for the last, all of us need to be optimism. We want to happy all the time. We try to happy in any situation, right? That is our needs, spiritual needs. Next slide, please. For the spiritual care, the nurse role in spiritual care will start with assessing the spiritual needs of the person and supported by a comprehensive plan of spiritual caring. We start with nursing process. We assessment first about spiritual needs of everyone, of every recipient. And then we make a plan for them with comprehensive plan. Because the people, we need to take care of them like a holistic. Although, but not all nurses may feel comfortable providing spiritual caring in all situations. The nurse should always be sensitive to the spiritual needs of his or her clients, because spiritual thing is very sensitive. Next slide, please. We need to be besides sensitive to all of things that the client show to us, like sit beside them and then touch them softly and hurt, or observe their feelings like that. Next slide, please. We take a look to the spiritual needs again. Astro conduct the research in 2016. He assessed the spiritual needs of 727 cancer survivors in New York. And the results found that only 3% of the cancer survivor report that a physician had inquired about their religious or spiritual needs. Only 3% of the doctor caring on that, their spiritual needs. Besides, the 23% claimed out that the spiritual needs were not met. Their spiritual, no one like take care of them. What is that? Including finding the meaning of the illness experience, their hope, medical treatment decisions congruent with their spiritual and religious beliefs, and meditation and prayer practice. Sometimes no one take care of that. They want to practice their merit or something like that. Moreover, the results show that when spiritual needs were not met, patients reported low satisfaction with care and lower perception of the quality of care. That the nurse don't want to be investigated, that to have low quality of care. Next slide, please. So the spiritual caring attends to a person's spiritual or religious needs as he or she copes with illness, loss, griefs, or pain, and it can help him or her heal emotionally as well as physically. We don't neglect about physically, we still take care of the physically also. Like this, if we can have do the spiritual caring, then they will have emotional healing, like how to break into the cycle of stress and trauma, and try to make them healing from that. Or someone like the woman there, she has a lot of things that is have a lot of knots around herself, like problems around her. How can we untie the knot? That is nurse's duty to do the spiritual care. Next slide, please. Spiritual caring can be powerful, positive force in helping patients reframe their illness. Sometimes people have illness, then they like turn to be someone else. We have to reframe their illness and finding greater meaning in life. They lost in the way, so we help them to finding the greater meaning in life again. And recognition what is ultimately important for them. Sorry, I missed the T. Important has to be T after that. Many researches results show that spirituality is an internal and valuable resource in coping with cancer. For this research that I'm said, that facilitates psychological adjustment and improves the quality of life and valuing them. Next slide, please. Yes. This is all of the theme that I got from my dissertation when I'm studying PhD in Philippines. Spiritual caring behavior, what does it mean? It will start with the first focus on the nurse-patient caring relationship. When anyone has a major life change, such as an illness, the person returns home evoking at a deep level of existential spiritual crisis. Everyone responds differently, depending on their experiences, their values, their belief system, perceptions, and the meaning of the condition, and all the situation around them, or support systems, encouraging, determining, and so on. They have many things differently, and so that's why they react out with their units differently in each person. So nurse-patient caring relationship is a helping relationship. For what? Provides nursing with an identity and differentiate it from other profession. We are identity, we are nurse, so we are not the same as the other profession. Next slide, please. The second of the theme is you need to have the responsibility to reach out. What is the reach out? Nurse took personal responsibility to reach out patients and relatives, not only patients, we take care of relatives as well. In the current situation, find the true needs of them and the suffering of them. And then nurse use humanistic care to consider the patients and relative problems and needs regarding physical, psychological, social, and spiritual dimensions by asking the question, observing and listen to, that is assessment to them. Next slide, please. And then nurse in the spiritual caring behavior have to engagement. The engagement focus on patients' description of their situations and how they general experience the impact of the disease had on their lives and how they would be able to manage that situation. So nurse has to be patient to listen to them, observe their behavior, and then correct everything for the spiritual needs. Then nurse provide care and evaluated care or treatment together with patients and relatives because we want it meets their needs, helping the patient regain autonomy, independence or independent. Some people have independence, it's okay, we take care of some independent, but we promote their autonomy. The next of the spiritual caring behavior is present of being in a caring moment. We need to stay with them. Present of being in a caring moment with her patient, the nurse will embrace the cultural practices, the values and beliefs of the patient, is acknowledging and values the spiritual aspect of caring, and has to caring based on patient needs and context. We don't think about it by ourselves. We need the patient and the sibling or the relative to tell us about the needs. So during the care process, nurses emphasize with patients and deliberately. Deliberately means focusing. We do it with intent to do, not just whatever. It just intend to do what is that. Use their knowledge and personalities to create a positive change in each patient. It includes the personality and the knowledge from the patient as well. They still have the knowledge, but sometimes they lost the way, so we just promote them. And for spiritual caring was described within the context of deep personal relationships, holistic care and support for the residents. Spiritual care response and similarity and differences in the experiences of participants were presented in this study. Okay, next. Next slide, yes. For the next theme of spiritual caring behavior is nurse press on self-dignity and human rights. Press on self-dignity and human rights for spiritual caring behavior can do by treating patients according to human rights principles, giving honor, respect, gentle, touching, and care willingly. Then they will know she's mine because someone take care of her. Next slide, please. Then the other thing of the spiritual caring behavior is nurse engagement in active caring and healing. Active caring implies the action and behavior that need to be carefully observed and recorded. Actively caring suggests antecedents and consequence control of behavior to promote desirable outcomes. So we need to set the desirable outcomes and then we reach that. Actively caring for people movement is a particular form of applied behavioral science. We still use science process to deal with the problem. Next slide, please. And the theme of one theme is around another to be active self-healer or carer. In this way is a patient. They need to be promoted to active self-healer because we can do that for them. They just do it for them, okay? Nurse explore and gather information as regards resources according to the rights and abilities of financial management of patients. They also promoted independence and boost patient self-confidence again because they low self at the time. Reboot it, encouraging them to do self-help activities. They can choose what they want, like this one, she want to play by herself whenever she have time. Okay, next. And the nurse has to be autonomy, promote the autonomy for decision making. The patient can decision making in anything around themselves. Patients' rights are considered by providing information, but we have to give them the information. Requesting consent for treatment, such as someone don't want to have CPR or resuscitation, they can write on the paper and say that, no, I don't want to put on the intubation or something like that. It's their right. They can choose. And explaining about autonomy for decision making and maintaining confidentially. We don't tell anyone, just nurse and the patient only. Next slide, maybe the last, okay. Thank you for your attention. Free to ask me in any question. Actually, I have a clip video. I don't know that I have time or not.
Oh, okay, 2 minutes.
2 minutes, yeah. I have one
IT
clip
team,
of
please
assessment.
play the video from Dr. Sangla. Can you play the video?
It's a very short one. For the assessment of spiritual needs. This is spiritual caring.
The one that they feel less prepared for.
This one?
And want more
no.
education in.
Not this one, Team
another
IT.
one. This one. This is for the nurse student also.
Gathering and organizing client data into a coherent format. This information then provides the basis for clinical interventions. Assessments can focus on social history, medical history, family history, and they can also focus on a client's religious and spiritual history. Spiritual assessment is the process by which healthcare providers can identify a client's spiritual needs, practices, resources, and any barriers to using their spiritual strengths in their recovery and wellness. Spiritual assessment is focused on how a client's religious and spiritual beliefs and practices function as positive and helpful, or sometimes as a negative dysfunctional coping mechanism. The ESOP interview you are learning in this course is systematic because it is structured so as to cover the critical areas of religious and spiritual functioning that can affect behavioral outcomes. These areas are represented by the letters in the ESOP interview. The questions represented by these letters cover religious and spiritual strengths, involvement in organized religious groups, and problems. More about what each letter stands for is covered in the next video. My colleagues and I have validated 16 religious and spiritual competency skills in survey studies and published the research in peer-reviewed journals. Conducting a spiritual assessment is the foundational spiritual competency skill that opens the door to building a therapeutic alliance, which research has shown positively impacts outcome. The interview is designed to elicit and harness a client's religious and spiritual strengths in their recovery and wellness. In a controlled study, researchers found that spiritual assessment was well accepted by patients. And another survey of people receiving outpatient services found that mental health care service recipients were interested in spirituality and wanted to discuss this with their mental health care providers. And the patients who were administered a spiritual assessment had significantly better appointment attendance. Taking a spiritual history is best thought of as a clinical skill that requires training and practice, rather than as a set of questions that can be administered by recipe or rote. It requires empathic engagement with the client. The interview should be conducted in a comfortable, quiet, and confidential setting and using a gentle, unrushed approach. The SOP can be used at an initial intake or administered when religious and spiritual issues arise in a treatment session to gather more clinically relevant information. Christina Puhalski is recognized as a pioneer in the movement to bring spirituality into healthcare. Dr. Puhalski is a professor of medicine at George Washington University, where she has focused on religious and spiritual issues at the end of life. She developed a spiritual assessment interview that is now taught in most medical schools in the United States. However, her interview, called the FICA, is tailored for physicians, whereas the SOP interview, which we are learning here, is designed for mental health professionals. But the guidelines she developed for communicating with patients about religious and spiritual issues are relevant for the SOP. She lists 4 key principles for taking a spiritual history. First, consider spirituality as a potentially important component of every client's life, one that affects their quality of life and well-being. 2, respect the client's religious and spiritual beliefs. 3, be aware of your own beliefs so you don't impose your religious and spiritual beliefs on clients. 4, make referrals to chaplains, spiritual directors, or community resources as appropriate. A lot more could be said about each of these points, and they are examined further in the course on ethical issues in spiritual assessment. She also lists 3 practices she does not recommend. 1, do not prescribe religion to non-religious clients or coerce clients to adopt specific beliefs or practices. This requires acquiring self-knowledge regarding one's own beliefs, and self-knowledge is the focus of another course in this series on spiritual competency. Number 2, do not force a spiritual history if a client expresses no interest. The screening questions in the SOP will enable you to make this determination. Number 3, do not spiritually counsel clients. Some religious and spiritual issues are best addressed by referring to a spiritual teacher or religious professional.
Yeah, can we stop this video?
Now let's get an overview.
Yes, thank you, because it's very long one. But it's good if you follow this script.
Okay, thank you for interesting material about spiritual caring behavior. And you have a great tool to assess the spiritual caring behavior. This is your dissertation? Yes. Ah, okay. Tool. Oh, yeah. Okay, the second speaker is Dr. Jirarat. Before explain the material, I want to read the curriculum vitae of Dr. Jirarat from Naresuan University. Dr. Jirarat, Bachelor of Nursing at Faculty of Nursing, Chiang Mai University at 1994, and then at 2000, she passed Master of Nursing Science program in Adult and Gerontological Nursing at Mahidol University, and then 2016, she passed Doctor of Education program at Educational Administration Nariswan University, and then the working experience registered nursing at Provincial Hospital, 15 years, and then she is a lecturer at Faculty of Nursing Nariswan University at 12 years. Interesting field, oncology nursing, advanced practice nursing, about breast cancer, basic nursing care, and nursing administration. Please explain your material, Ms. Jirarat, your time 15 minutes. Time is yours.
Okay, thank you very much. Good morning, everyone. สวัสดีค่ะ I'm Jirarat. I am not good for today's topic. I'm nursing administration, and today I would like to talk about transcultural nursing. In Thailand, nursing students will be study on 4th year. Okay, next. This call for this today, next. This picture is a good meaning because we are the world. Okay, next. She is a nurse. Madeline Leininger, she is a nurse. She received a Master of Science in the Cultural and Social Anthropology. And a formal area of study and practice focuses on comparative holistic culture care, health, illness pattern of people who respect to difference, similarities in their cultural value, belief, and life way with the goal to provide culturally congruent, competent, and compassionate care. Next. This figure 1, she showed the sunrise model. This theory proposed the idea that nursing should provide patient care that align with the need, ethnicity, and culture. It emphasized a holistic approach to care that allow nurses to analyze all factors that influence a person's health or illness within their culture and social context. Next. This sunrise model, the concept suggests that nurses choose provide patient care that align with the needs, ethnicity, and culture of patient, while adhering a holistic care approach. This approach helps nurses analyze all factors that influence individual health or illness within the context of their social, cultural background. These sunlight models consist of 2 parts. Next. The upper half of the circle represents the worldwide of the individual from different ethnic, cultural background, including their cultural care, worldwide, and cultural social structure. This encompasses aspects such as religion, economic status, education, technology, and other, including the individual lifestyle and self-care practice when influence the nursing care provided. In addition, the characteristic of the environment, language, and cultural heritage are important components that help indicate specific needs and practice of individual, family, community, and various institutions. Please next. The lower half of the circle represents the healthcare system and various approaches or methods that lead to be beneficial and appropriate nursing care aligned with the individual groups, lifestyle who receive healthcare service. Generally, healthcare system is different society consists of both generic and folk care. Generic and folk care is a system when community members learn on their own to take care to themselves or other. It involves self-care practice. On the other hand, professional care is a healthcare service system influenced by Western medicine and include various healthcare professionals such as nurse, physician, psychotherapist, and others. Both components of Sunrise model can use as a guideline for nursing care for pattern more effective through process related to culturally congruent care. These three essential processes include cultural care preservation or maintenance, cultural care accommodation or negotiation, and cultural care repatterning or restructuring. Okay, this slide I would tell you about cross-cultural leadership. I use cross-cultural because leader must be understand cultural many people and apply to be for a leader, not transcultural. Okay, next. An XLQ model from Grisham, T. and Walker show this figure is like a steering wheel. Next. The XLQ model is represented by a steering wheel diagram. At the center of wheel is represented trust. The spoke of the wheel include transformation, communication, power, and empathy. The tool for managing this model effectively is conflict management. Next. Important characteristics of culturally inclusive leader include 1. Cultural intelligence, global identity, and openness to the cultural diversity. Next. Cultural intelligence is about the ability of individual to thrive in a culturally diverse context effectively. It consists of 4 parts. 1 is metacognitive CQ, 2 cognitive CQ or CCQ, 3 motivational CQ or MOCQ, and 4th behavioral CQ or BCQ. Next. 2 global identity, the expression of identity which reflects one sense of self-identity, personal trait, feeling, and behavioral as well as social self, which relate to one membership in an organization. 3, openness to cultural diversity. An individual who is highly open-minded toward cultural diversity tend to perceive different a positive light as willing to learn about these similar or others striving to understand those differences. And next slide. Transcultural nursing leadership competency. This research is from Thailand. Consists of many One, able to apply policy regarding service client to individual with culture different in the workplace. And two, able to improve work practice and that are appropriate and aligned with the cultural background of clients. Three, able to seek solutions to work-related challenges in order to enhance service delivered to culturally diverse clients. Four, able to make decisions to address issues that arise with culturally diverse clients. And next, and in this slide, next. Okay, and next slide. And the characteristic of a nursing leader: one, job relevant knowledge and cognitive complexity. Two, effective talent management. Three, behavioral flexibility and cultural sensitivity. Four, honesty and integrity. Next. Developing cross-cultural leadership. Okay. One is provide knowledge about culture. Two, exploring diverse management approach. And three, application in work. Okay. Next, importance and impact of culture. The difference of cultural value and belief among patient, nurse. Organization may affect to nurse-patient relationship and service quality and patient safety. And this three circle is intersection about organization culture, nurse culture, patient culture. At the center of this three circle is the good nurse, I think. And last slide. For example, in Thailand, nursing can use Gordon functional health pattern assessment. It is the tool for cultural nursing. It's one tool. And the second disease management is the nursing management in Thailand. I think it's a good for cultural or diversity. And the last one is primary nursing care. Primary nursing care is the nurse to be take care one patient in one shift. She is to know all of patients in 8 or 7 hours when you work on the hospital. Okay. Last slide. Okay, thank you for your attention.
Thank you, Dr. Jirairat, for the great material today about transcultural nursing. I think about Sunrise model and SLQ model can use in Indonesia because Indonesia have many islands and many cultural. So as a nurse, we must provide service according to their culture too. Okay, we move to third presenter or third speaker, Dr. Worawan Taipwarum. Before it, I will read the curriculum vitae of her. Assistant Professor Dr. Worawan Taipwarum, the Education Bachelor of Nursing at St. Louis Nursing College, Bangkok. And then she passed Master of Public Health at Mahidol University, Bangkok. And then postgraduate of Public Health Nursing at Mahidol University, Bangkok. And certificate in nursing specialty in nurse practitioner at Naresuan University, Thailand. The honor, first class in honor in PNS, St. Louis Nursing College. And her experience, staff nurse at St. Louis Hospital, Bangkok, Thailand, from April 1996 until October 2000, and instructor at Faculty of Nursing, Christian University, Nakhon Pathom, Thailand, and then instructor of Faculty of Nursing, Naresuan University, Pitsanuloke, Thailand, November 2002 until now. And field of interest, sexual behavior among adolescents, same with this theme today, sexual transmitted disease, adolescents health, condom use, school health nursing, and home care. And now you explain home health care, right? Okay. Please present your material. You have 15 minutes to present. Time is yours.
Okay, let's wait. Selamat pagi, สวัสดีค่ะ Today, even though I'm interesting about the sexual health of in adolescent, but I'm thinking, at first I plan to make a lecture, special lecture about risky sex in adolescent here. But thinking about it is an Islamic country. That's why I changed the topic to home health care might be safe. At first preparing about the condom use in Thailand in adolescent might be next time or maybe when we have a chance. Okay, this is might be a safe topic for me here today about home health care in Thailand. Okay, let's next. Home health care is the broadcasting. It is a big word. It's talking about home health care. It means many multidisciplinary go together. Nurse, physician, pharmacist, and nutritionists that go together to help the people in home or in the house, in the family, in community, to feeling good or have a good health. Okay, next. Thinking, okay, next slide please. Thinking about yesterday, we sit in lecture in campus A about the topic Islamic boarding community health nursing. And I'm thinking about after listen to 15 minutes that the same process in Thailand about home visit or about take care of community in the same I think the same process, the same nursing process, we use the same, but something different. That's why today I would like to talk about this home visit. A home visit is one part of home health care. In Thailand, we separate home visit. There are 4 kinds of home visit. First one about we go home, we visit the patient at home because we want to caring patient about emergency case, acute case, and chronic case. The second one for dying care home visit. I mean people during in the palliative care. And the third one about the assessment home visit. To be there to checking about the people who has chronic disease, they have medicine or not, or they have a good health or good practice or not. And last one about the hospitalization follow-up home visit. About home-bound elder and bed-bound elder might be the same here. Next slide please. Okay, this is not smart. Okay, in Thailand, I make everything in one slide. Before we taking a home visit, we have to make a plan first. The plan means we have to have a plan like nursing process, the assessment and everything, and prepare the staff and the stuff and the material before we go. After that, it is called a medical management. If you want to make a home visit, you have to have a knowledge. You have to know that, okay, today we're gonna visit the patient who has diabetes and they have a insulin injection. What we gonna do with this case? Or maybe he has a CAPD, you know, right? About the chronic disease, like that, kidney chronic, CKD, chronic kidney disease at home. Then we have to knowledge to how to take care of patient this group. After that, next. identification of patient need. It means we visit them because patient needs us. We did not go home visit, making a home visit because we want to go. Patient need us first, then we go. Okay, that's why very important thing. We did not go because, okay, today we have time, then we want to see you how. We cannot do that. We have to make appointment first with the patient. And continuing patient-centered care, that is the same. In Thailand, we use 4 things. I think you have learned about the patient feeling, patient ideal, patient function, and patient expectation. That is the same. Ideal, feeling, function, and expectation for patient. That we have to investigate every time when we be there. And next, talking about the, back. But participation and family conference, have to talk with the family member together. And evaluation of quality of care every time. And risk evaluation and health promotion. Because we are community health nursing, then we did not pay attention much. In Thailand, we have 4 jobs, 4 dimensions for nursing. The first one is nursing, health promotion, health prevention, health curing, and last one is rehabilitation. That's the same here, 4 dimensions. Most of community health nurse pay attention in the health promotion and health prevention. That is our job. Next is reassessment of care plan. Sometimes we found that we give a nursing care for patient at home already. Why they're not feeling good, or why they're still the same, they're not better. That's why we have to go back to reassessment, what's wrong with our plan. And the last one is teamwork. We cannot making a home visit alone. We need a teamwork. Maybe physician, sometimes nutritionist, or maybe a pharmacist can go with us. Okay, next. Next slide, please. Next slide. Okay, this I would like to show about the uniform like I wear here. It's the community health nursing. Always work in the community, we wear in this way. And that my student uniform. Woody, can you stand up? That is that is my student uniform when they work in the community like me, the same. When we go to community, we wear this. But when we practice in the hospital, we're gonna wear a white uniform. That's different. White uniform and a hat. This working in the community. And one material very important for us is a bag. Inside the bag might be the same here, thermometer, Swico nanometer, some dressing, some packet for wound dressing, something we have that like a medical bag that we carry together. And that picture I show about the before students go outside or practice in the community, they have to make a role play how to use the bag. You can see that, just a testing how to use the bag. In Thailand, we still has what you call something to protect the dirty, but right now we don't use it already. Next, please. Yeah, and we use it as a tool to assess the family in the community. We call it homemade material. Long time ago, we used Gordon. You know Gordon, right? 11 pattern of Gordon. That used Indonesia the same. 11 pattern of Gordon, but right now we use in homemade. We use it maybe for 20 years in Thailand already. The consists of 10 or 11 things. These come from the United States. Okay, next, please. We start from immobility. This is assessment the family or patient by immobility impairment. Such we using ADL for elderly, such as basic ADL, how they can dressing, eating, ambulating, toileting, hygiene, and instrumental ADL such as shopping, housekeeping, accounting, like this. This is the first one for access. If patient can do it, okay, they don't have this problem. Next, please. Next. Nutrition. The same, we weight the patient, we high, and then we found the BMI to see the nutritional status. Look at the food, what they have each day, like that. Open to their kitchen, the family kitchen, what they eat. If they are diabetic and they still eat a lot of salty, that's not good for health. That's why we checking. Next, please. Housing. In Thailand, we seeing about youth housing, we see inside and outside. Inside, we did not see how rich they are. We just seeing how they keep their house is clean or not. Is healthy, how they have enough light. They have a airflow, can breathe that clean, that's or not that inside. The same as outside, what we see about garbage outside, who near him, that's the environment good. In that way, we seeing this. Next, other people mean family member and caregiver. If we have or they have a patient on the bed, then they're gonna check how many family member of this family. 1, 2, 3, 4, 5. That's enough to take care of the patient. And what is caregiver? Who is the caregiver? That's all. Next, medication. That we're gonna check every single tablet or medication of the patient in that family, what they eat. And they eat it right. In Thailand, we use, I'm not sure, sick right or sick rule when you typing. Lifetime, life patient, that's the same. Lifetime, life patient, life prescription. I forget it already, did not teach it for a long time. Next. And examination mean every time when we be there, at least we have a vital sign for our patient outside. And about the, we call examination about the physical examination too. Okay, next please. Safety. Safety mean when we be there in the house, we just looking for what is the problem with the house, such as if they have older or elderly, but they have step. You see like a stand, step, that difficult for elderly to walk. We will say this not safety. Or if they have a kid, and they have steady way, it's still dangerous for the kid too. Okay, next. Spiritual health. When we go inside, we look at the house around, what the picture on the wall. Such as they have a king, a queen, or maybe they have a Buddha, or some picture about they believe spiritual, or maybe they have a star, the superstar or singer on top, that we can check from that what they believe. Next, might be the last one, about the service. This is a health promoting center in Thailand. It means this may be like your breastfeeding center, I think pretty close. But this is very complicated and complex because we have many services here, such as for postpartum, for antenatal care, and for well baby clinic, and everything is here. We have a service in Thailand, and this stay in the community. In one community, they have one of the health promoting health center, and each one have a nurse, public health, and always have a physician be there once a week, one time a week for patient. That all we call in-home meds for everything, IMH, OMESSS. That is the last thing when we go making a home visit. We're gonna use this to assess our patient in the community. Okay? Thank you for your attention.
Thank you, Dr. Wurawan. It's great material, interesting presentation about health home care. There are many aspects of health home care, such as nutrition, in homes, and then etc. Many more about home health care. And then we move to last speaker from Universitas Nahdlatul Ulama Surabaya. Please welcome Dr. Karyatul Afia. Okay, before she explain the material of today, I want to read the curriculum vitae. Dr. R. Karyatul Afia come from Gresik, especially from Bawean Island. Bawean Island is a beautiful island in the north of Java. If you go to Indonesia again, you must visit Bawean Island. It's island have beautiful beach, right? Okay, I will continue read the curriculum vitae. Miss Rere, okay, I can call you Miss Rere? Okay. In educational experience 2003, she passed nurse in Universitas Airlangga Surabaya, and then in 2011, she passed the maternity nursing specialist at Universitas Indonesia, and then at 2022, she passed doctoral Universitas Airlangga Surabaya, and then the work experience 2003 until now, she is a lecturer and at nursing at midwifery faculty of Universitas Nahdlatul Ulama Surabaya. And then the specialization of Miss Rere is maternity nursing. Okay, Miss Rere, your time is 50 minutes. Please explain your material and time is yours.
Thank you. Bismillahirrahmanirrahim. Good morning, everyone. Now is the second time I stand in this stage, but I still feel nervous. I need do something, maybe inhale, exhale. Okay. Thank you for giving me the opportunity. I'm Hairiatul Afia, lecturer in Faculty of Nursing and Midwifery Universitas Nahdlatul Ulama Surabaya. Today, let me share to you how risky sexual behavior in adolescent. I think this topic very related with the current condition of the growth technology. So many social media platform that provide to everyone to share information, including about sexual behavior in adolescent. Well, I will start the definition of adolescent. Slide.
The slide, please. Any problem?
Okay, slide. Adolescence is a period of transition from childhood to adulthood, where at that time there was rapid growth including reproductive function, thus affecting the occurrence of changes in the development of both physical, mental, and social rules. Next. Adolescent physical development start from primary sex and as a sign of maturity of the reproductive organs. In teenage boy, puberty are normal, start from 10 till 15 years old. And women with menstruation, normal age, start from 12 till 16 years old. Next. Okay. Okay, we continue with the main topic. Risky sexual behavior is sexual behavior that is detrimental or result in unexpected things. Kalau di Indonesia kan ini adalah bahwa perilaku seksual yang akhirnya mengakibatkan suatu kondisi yang tidak diinginkan. Tentunya kalau tidak diinginkan itu adalah sesuatu yang tidak baik. Next slide. Oke. Wow. Ini the last material is so hot. Related with the mostly audience is teenager. Okay, this below kind of risky sexual behavior. The first behavior is touching. Touching is the step one. The couple in expressing falling in love, right? Number 2, kissing. The second step in experiencing deeper feeling of love, right?
Okay, right.
Number 3, necking. Wow, necking. Necking is kisses and licks on the neck and ears. The 4, petting. Petting is some like foreplay before intercourse. Petting is part of the foreplay before sexual intercourse. Usually, petting is done by swiping the male sex organ against the female intimate organ while still clothed or not, right?
Okay.
Okay. The last kind of risky behavior sexual is sexual intercourse. Sexual intercourse is sexual relation between men and women. Next slide. Factors influencing risky sexual behavior. The 1, age. Early menarche has the opportunity to engage in risky sexual behavior 4.65 times compared to normal puberty. Jadi artinya bahwa perempuan yang mengalami menarche dini itu lebih beresiko 4 kali 6 kali dibandingkan dengan yang mengalami pubertas normal untuk melakukan perilaku seks yang berisiko. Jadi sebelumnya harus tahu dulu berapa usia normal dari menars. Yang early berarti beresiko tinggi. Kira-kira ada yang 9 tahun sudah menstruasi? Oh, belum ya. Oke. Kemudian number 2, gender. In this case, there are more male than female. Male 53% and female 47%. Educational level. The level of education influences changes in attitude and healthy living behavior. A higher level of education will make it easier for a person or community to absorb back to okay. A higher level of education will make it easier for a person or community to absorb information and implement it in daily behavior and lifestyle, especially in terms of health. Next. Family rules. As educator, the education and knowledge they get from school, in addition to religious and moral values. Number 2, care, protection, and control. Control the attitude and behavior of adolescents so as not to fall into social that lead them into promiscuity. The influence of peers rule. The one, parties involved in social intercourse. Artinya ini adalah pengaruh peran teman sebaya yang bagaimana yang bisa mempengaruhi perilaku seks beresiko. Yang pertama adalah pihak yang terlibat pergaulan. The 2, activities undertaken while socializing. Kegiatan yang dilakukan selama bergaul. The 3, the intensity of social intercourse. Berapa seringnya dia kontak dengan teman sebaya. Next. Oke. The effect of pornography media. Adolescent is the most at-risk community for exposure to pornography because adolescents are at the stage where they start to find out because their curiosity is very high. Nah, remaja ini adalah kelompok yang memang beresiko tinggi karena di saat remaja rasa keingintahuannya itu terlalu tinggi sehingga dia penasaran. Makanya jangan pernah membuka-buka media yang terkait dengan konten-konten pornografi. Begitu ya. The next, impact the one bicycle can be affect abortion. Abortion is the ultimate choice for couple who don't want to consensuality baby. Jadi aborsi itu merupakan pilihan bagi pasangan muda yang hamil di luar nikah atau unwanted pregnancy. Kemudian aborsi akan mengakibatkan abortion is increase the risk of maternal death due the excessive bleeding. Jadi aborsi itu merupakan resiko tinggi kematian ibu karena perdarahan. Oke. Impact physical unwanted pregnancy. Jadi kalau di Indonesia kan itu kehamilan yang tidak diinginkan. The three sexually transmitted disease such as syphilis, gonorrhea, chlamydia, and genital herpes, and HIV. Next, impact for psychological anger, fear, anxiety, depression, low self-esteem, and guilt. Jadi efek pada psikologi, seseorang itu akan merasa marah, takut, cemas, depresi, kemudian harga diri yang rendah serta perasaan bersalah, feeling guilty. Impact for social. As a result of sexual behavior that should not be done yet can result in pressure from society, changing rules, dropping out of school until they can be ostracized. Free sex, drug abuse. Drug abuse, some research show that drug abuse has an effect on risky sexual behavior. So don't get close to drugs. Next, prevention. With youth community approach has an important role in human resource development. Prevention with family approach expected bring out a sense to belonging to each other. Jadi pendekatan pencegahan itu melalui pemuda. Karena apa? Pemuda itu merupakan suatu aset untuk pembangunan negara. Kemudian yang kedua adalah family approach. Expected bring out a sense of belonging to each other. Jadi berharap untuk mempunyai rasa saling memiliki di antara sesama anggota keluarga. Thank you.
Is enough?
Yes, enough.
Okay. Thank you, Ms. Rere, for amazing material presentation today. Talk about sexual behavior in adolescents. From your presentation, I know that family roles is very important to prevent risky sexual behavior, right? Okay. Okay, all speakers have finished the presentation, and then we move to second session. I will give chance for all participants to ask all about the material from Dr. Jirara, Dr. Sanglar, Dr. Worawan, or Dr. Rere. Please ask something, and before you tell the question, you must tell your name, where you came from, and then for who your question. Okay? Raise your hand if you have a question. Okay, from midwifery, right? Okay, thank you.
Baik, Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh.
Good morning and sawadika. Thanks for giving me the opportunity to asking at this time. My name is Cindy Naka. I'm from midwifery. I have a question from Ma'am Warawan.
Wurawan, okay, for Dr. Wurawan.
How the community practice in the Thailand and what is have community specific? Thank you.
Okay, about community in home health care. All right, community, all clear?
You
For
mean
you?
yeah. I am a community health nursing. Okay, I'm teaching that in this field. And your question is this specific, right? For community health. That's a good question. Because in Thailand, I teach my students about if you want to be a community health nurse, you have to have every single knowledge. You have to know adult nursing, you have to know mental health nursing, and you have to know about pediatric and maternal health nursing, everything, because when you go to the community, you cannot select the case, right? In the community consists of a lot of patients, many kind of patients. You have adult, you have a kid, you have adolescent, you have elderly, and many kind of disease too. That's why if you work in this field, community health nursing group, you have to know everything. That's why very broad. But we know everything broad. That's why the same as we work, if we work in the health center, work in the community, when you see a kid, you have to have health education, how to teach the kid or the infant or breastfeeding, every single one. Okay.
Many aspects in community care, right? Okay, are clear for you? Okay, thank you. It's enough. And then next question, please. Oh, many questions. Please choose just one. Okay, thank you. Tell your name.
Okay, my name is Putri Arsa. I'm from Facultas of Nursing. I want to ask Miss Rere. And my question is, does a free sex happen in relation to same-sex relationship? Thank you.
Okay, thank you. It's clear for you, Miss Rere, about free sex.
Okay. Free sex is sexual activity man and woman, girl and boy. If sex male and male, it's not free sex, but that's sexual disorientation. Okay. Thank you.
It's different about free sex and sexual disorientation. I know that lesbian and homosexual is not include free sex,
yes.
but as dysfunctional sex.
Yes.
Okay, it's clear for you. Okay, it's enough, Miss Rere. Okay, next question, please. Oh, there are 3 questions. 4 questions. Please choose one. Okay, black hijab 1. Thank you. Tell your name, where you come from.
Okay, introducing myself. My name is Ali from the Bachelor of Nursing Study Program at Nahdlatul Ulama University. I want to ask a question to Dr. Khairiatul. I have 2 younger sister and one of them is menstruating, sudah menstruasi, salah satunya dari 2 adik saya. Regarding the age of the child, I want to ask at what age can sex education be given for children? Kemudian untuk and how do we provide education about sex to children so that children curiosity does not occur in negative direction? For example, trying out finding or the konten negatif, penasaran atas seks itu apa, kemudian di searching
Okay, next.
di searching atau dicari tahu sendiri di Google, kemudian akan menimbulkan konten-konten negatif lainnya akan muncul.
Oh, di-explore begitu ya?
Ya,
Di-explore.
ya. Nah, itu bagaimana cara untuk mengontrol? Karena kan seperti yang kita tahu sekarang, orang tua atau sebagai seorang kakak itu tidak bisa mengontrol HP yang sudah dipegang oleh anak.
Okay, it's clear for you, Miss Rere, about sexual education.
Baik.
She have two youth sister, youth sister.
Ya,
Baik.
younger sister.
Karena
Thank you.
penanyanya pakai bahasa Indonesia, saya juga pakai bahasa Indonesia.
Oh.
Tolong nanti moderator mentranslitkan. Oke. Baik. Untuk pendidikan seks sejak dini itu memang saya pernah mendengar, membaca bahwa pendidikan seks itu harus diberikan sejak usia dini. Jadi kita itu harus menyampaikan secara vulgar, tidak boleh menutupi kata-kata yang memang jadi suatu hal yang tabu di masyarakat kita. Masyarakat kita kan masih besar rasa malunya, itu sebenarnya baik. Tapi untuk pendidikan seks itu kita harus lebih vulgar. Contohnya, kalau kita mau memperkenalkan alat kelamin, laki-laki atau perempuan, itu tidak boleh menggunakan kata ganti. Misalkan, mohon maaf, vagina. Vagina itu tidak boleh kita menggunakan bahasa lain. Kita harus menyampaikan secara vulgar. Ini vagina, ini penis, begitu. Sehingga anak-anak kita itu tidak mencari tahu dari tempat lain. Jadi nanti dia punya satu pintu bagaimana dia akan bertanya dan bagaimana dia mendapatkan jawaban yang baik dan benar. Begitu. Untuk menghindari anak-anak untuk membuka konten pornografi itu kan memang tidak diperbolehkan untuk menggunakan gadget sesukanya. Tetapi ada waktu-waktu yang memang kita harus berikan. Memang susah, tapi memang harus diterapkan, harus rodok kejam gitu ya, begitu. I think enough.
Okay, it's clear for you. Sex education must be carried out an early age. Yeah, explain in the right word for genitalia, such as a vagina and penis. Use right words, not other words. And then limit the use of gadgets, right? Not all the time using gadgets. As we know, children in Indonesia is very addict with gadget. So family role is very important to restrict the using of gadget. Yes. Okay, the next question. Oh, the male one.
Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh.
Good morning. I have a question to Dr. Sanglar. It's a very good material, and the question is, the spiritual nursing care have a relation with the religion, right? And my question is, if the person not believe with the religion, how we do to giving the spiritual caring to the person or the patient? Thank you.
Okay, thank you. It's clear for you, Miss?
I have asked you that you mean religion, the same religion or different religion?
The different religion. The person have atheism or something like that. Nah, how we do to giving person with atheism for spiritual caring?
Yes, thank you. Yes, we can do events in different religions because first of all, that I've said, you have to assessment first about their spiritual needs, the belief, their religion, their supporting system, and anything about that all around. Like if I want to do the spiritual caring with your country or your group. I can do that. I just explore your need first. And after that, I will make a plan that is concurrent with your life here. But I can say that the spiritual caring does not mean only the religion. It means it's broadly, it can, yes, everything like your concern, your belief, your, what is that?
Mind,
Yes,
body,
like
and
that.
soul.
Yes.
Comprehensive of mind, body, and soul.
Yes.
Not just a religion.
Yes. Religion is one thing, and the other things that concern of the patients, you need to explore as well. Some people, they want to like have the successfully in their life, in their work. How can we promote them to can take like have sometimes they lost in the way like they don't have self-confidence to do something, but they want, we have to try to empower them to reframe themselves again, because sometimes they get illness and then they forget and then, no, I cannot do anything. So you set the goal with them, the goal of them first, and then after that we make a plan together like that. It may be sensitively, but we can do that. Thank you.
Thank you, Dr. Sanglat. It's clear for you?
Yes, enough.
Okay,
Thank you
so
so much.
spiritual behavior, spiritual caring behavior can use to all religion. Nursing purpose is the patient wellness, yeah. Okay, the next. Okay, from Nariswan University. Depan, yang paling depan. Ini yang dari Budi. Okay, thank you.
So I have a question in topic prevention of risky sexual behavior in adolescent. I will ask if we are unable to control the risky factor in sexual, and then how should we go take action to prevent pregnancy and sexually transmitted disease in Indonesia?
Okay, thank you. It's clear for you? From Budi, right? Okay. This is about how to jadi bagaimana bagaimana mengontrol faktor-faktor yang menyebabkan risky sexual behavior, to control factor of risky behavior and how to prevent sexual behavior in Indonesia. It's right?
Yes.
Sorry, mix bahasa and English.
Yeah, yes. Prevention risky sexual behavior in Indonesia, focusing to youth, no.
It's okay, Miss Rere.
Wait just a moment, okay? Okay. Preventive to risky sexual behavior in Indonesia, focusing to youth community approach. Yes, because an important role in human resource development. I think enough. Thank you.
Okay, thank you for two points to prevent the risky sexual behavior. Okay, it's clear for you? Not clear? Bagaimana mengatasi faktor-faktor tadi kan banyak, Bu Rere. Faktor-faktornya banyak. Nah, itu bagaimana caranya mengontrol faktor yang banyak tadi. Mungkin itu yang belum terjawab. Kan faktornya dari faktor orang tua, faktor teman.
Approach with religious, moral values.
How to control the factor of risky sexual behavior with religious, with spiritual behavior like this, and then moral with moral, and then okay, it's clear for you. There are many program in Indonesia for controlling many factor to risky sexual behavior. Okay, it's clear for you, Budi?
Yes.
Okay, thank you. There are any question again?
Yeah.
Oh, okay.
Wait, okay, last thing. Just thinking about, because I'm listening about the risky sex too, just want to share a little bit from Thailand. In Thailand, thinking about how to prevent in the school for the Thai government, we established about the sex education program. That's last 10 years already, maybe 15 years already. They put for the student in the elementary school, junior high school, and high school, and especially in the university too. And we found that that program is some work, but some not work. And then last 4 years or last 8 years ago, they established the condom use policy in Thailand. That for 6-year policy to encourage every people in Thailand, especially adolescents, using condom.
Okay.
They prepare a condom use free condom for the kid. If you are in the school or high school, you want a free condom, you just talking with your teacher about maybe a nurse or a teacher
Free
in
condom.
that school
In
and
Thailand.
give you a free.
For teenager, a free condom for teenager at Thailand from higher school until university school, right?
Exactly, yes. And you can see that if school don't have it, you just walk to the health center, like community health
Oh,
center.
yes, yes,
They
Puskesmas.
prepare it for free. It's free.
Free condom for teenagers, yes?
Exactly. Even though established about this program, many kids, I mean the students use condom a lot, but still have the rate of the unwanted pregnancy.
Oh, yeah.
And about the abortion rate, about the rate of sexually transmitted still increase highly. That is okay for a time, but now it's still increasing highly the same. Then government try to establish a new policy right now for the kids, how to make them use condom use with the right way, using condom correctly. You understand? Not make a mistake or make an error when using.
Use condom
correctly.
Correctly, okay.
Yes, correct. They know how to use, but they don't know how to put inside, how to take it off. Huh? They teach, yes, the teacher or the nurse teaching. And we always have, like me, or from the health center, go to school once a year to teach them how to use condom with the kid. Give them a free condom. They're different from here.
Okay.
And and we cannot prohibit because we use internet too. That's why porno movie, pornography, everything on the cell phone.
Gadget,
You cannot stop them. Right.
Okay. So in Thailand, it's very different with Indonesia. In Indonesia, condom must buy to Indomaret, Alfamart, yes. But in Thailand, free for teenager, for higher school and university. So it's prevent the risky sexual behavior in there. It's right?
Exactly, it's free.
It's free for teenager.
And they have one program too. Some students, they don't use condom and they're pregnant. What they gonna do? They just take that kid, like in the university or adolescent, go to the hospital to have a, what you call implant.
Oh, implant, okay.
Exactly, it's free.
Implant are free?
Free for the student or for the adolescent.
Implant for adolescents is free?
Yes. If that adolescent used to pregnant, if they pregnant or if they used to pregnant, it's free.
They cannot use for new case unless they have kids. After they have one kid, and then they can have implant the contraception. Yes.
Oh, okay. So contraception in Thailand is free too, about implant, and if there IUD, intrauterine device, it's free. Oh no.
IDU is free, but
It's
we
not
don't.
free.
It's not population. It's not popular there. Because it's, you know that if you IDU, you're gonna taking the line every day. That's not good, and decrease the sexual pressure.
Okay, many contraception is free in Thailand and in Indonesia. Everything is free, yes? All contraception, about condom, implant.
We can say that governments pay all for the health insurance, like the government coverage all of that. So not only for the sexual things, but for the like a curative or medicine, they just pay nothing. Government pay for it.
I think it's different in Indonesia. Sometimes free in Indonesia, sometimes free with assurance called BPJS in Indonesia. But if we have BPJS, it must pay for hospital. Okay, thank you. And the last question, Kak Ros, nggak jadi Kak Ros. Okay, Miss Rosdia, just one question.
Bismillahirrahmanirrahim. Good morning. I think student from Narration and the lecturers know me yesterday. I'm Rusdia Ningsi. Maybe this is not a question regarding home health care. In our country, especially in Surabaya, we have also home care. But there is a home care organization. When the patient discharged from the hospital, and if they want to continue caring in the home, they should ask to home care organization, and that one is not free. They should pay. The family patient should pay regarding what caring they need. They should pay. But for our student, nursing student, we have also family nursing subject. And we have around 5 to 6 weeks for students doing practice in the family. They have to take minimal 2 families, and every student have to do nursing care plan from the assessment, nursing diagnosis, intervention, implementation, and evaluation. Maybe the first one, home care organization, maybe that one only different with Thailand. We should pay. That's why when patient going discharged from the hospital, maybe only small little patient they need care, because according to the economic, financial, and everything. But in our public health care, yeah, we have so many public health care. They have also one program visiting, home visit. But that patient not only from the hospital, maybe they are checking the health in the public area. The nurse in the public area will do home visit. Otherwise, if according to public health care, they don't need a nurse to do the home visit, they will not do. So by request and by paying, that's maybe the friend. We hope the next we will do more better then. Okay, thank you.
For in Thailand, we have volunteer people who stay in the village. They got some more money from the government, but they will take care people in their village, like 5 houses that they take care of. That is very good.
Okay, thank you.
That I think is pretty close because in Thailand we have a referral system. It starts from the people in the family or the community. If they sick, they go to the health center first. Health center gonna give them a paper to the hospital if they cannot take care of. So that they have appendicitis, go to the health center. Health center give a paperwork, send them to the hospital. We call referral system. And hospital make an appendectomy. And when they discharge, they back. And the hospital send the information of that patient back to home to the health center. Then health center send a nurse, visit them in the house. It's free. We did not pay. And according to Dr. Sangla talk about, we call healthcare volunteer, used by the local people in that place. One healthcare volunteer take care of 10 to 15 family in the community. If you have a lot of house, then you have a lot of healthcare volunteer too. Okay, everything government pay. Free.
Okay, it's very good. In our country also, there is a program One Village, One Nurse, but still little, little area they have like that. Still maybe still difficult for us. One village, one nurse. That is support by our government.
How about if they have some problems on the night time or evening time, not just daytime? The nurse has to go to visit them at the home or not?
No, yeah. If there are problem maybe in the night, in the afternoon, we have some public health care. They are opening 24 hours. Otherwise, they should go to hospital to emergency hospital emergency room.
It's okay. Okay, it's clear, Mistress.
Thank you very much.
Good government support in Thailand, yes. Okay, I think it's enough, but I want to ask just one question, okay? Okay, before I finish this session, I will ask about transgender in Thailand. Transgender issue in Thailand is very famous. So transgender in Thailand very pretty. And then Thailand is famous for genital surgery. In Indonesia, issue is Thailand's famous with genital surgery, right? Like transgender. In Indonesia, transgender people are at risk for sexual transmitted infection. So government focus to decrease STIs, sexual transmitted infection, and HIV with routine examination and then counseling especially for transgender group. And then promote condom but not free. And how about in Thailand to prevent the sexual transmitted infection, especially at transgender? Transgender prevention and risky sexual behavior, and then
in Thailand we talk about the equality. I mean the human right or the equality between transgender and normal gender. The same, we the same. We did not prohibit or we did not. I mean, we not close or prohibit about the risky sex or give the special thing for the transgender. That the same as the normal one. Yeah.
Same care too.
The same care, everything the same care. Because we think about human rights. We did not, I mean, we cannot blame you are transgender or you did not blame in that way. We just open it free. I mean, it free. It's open.
But focusing about STEs in transgender, focusing to decrease STEs for transgender or lesbian or homosexual lah, to decrease STEs. How about it?
Oh, in Thailand we have a big group we call a rainbow. Have you ever heard? Rainbow, rainbow. Rainbow, 7 colors.
Oh,
rainbow.
Yes. Okay.
We have a rainbow group. That is a big place, big community in Bangkok. And if you see, I'm watching the television in the hotel, see about they have a parade just a couple days ago in Thailand about the transsexual rainbow. Like that. They have that parade every year to promote them, to open them, and fight for the law about marriage law. They want to marry together, male marry with male, female marry with female in that way.
Okay.
They're really unique.
Okay, thank you. Very clear for me. Okay, I think it's enough. Time is up. We got a lot of knowledge today about spiritual caring behavior, and then home health care, transcultural nursing, and risky sexual behavior. How a great material today. Now, before I close the session, I will invite the Dean of Nursing and Midwifery Faculty to give the appreciation certificate to all speakers. Please stand up in center of auditorium.
Thank you.
Okay, thank you, Ms. Hamida, as a Dean of Faculty of Nursing and Midwifery Faculty UNUSA. Thank you for all speakers and all participants. Forgive me if my English is not clear.
Thank you for your attention. See you in another chance. Wassalamualaikum warahmatullahi wabarakatuh.
Thank you, Madam Esti Pujirahayu, for leading the lecture and discussion.
Ladies and gentlemen, finally we come to the end of this event. Before we close our event today, I'm Muhazirin Khairai.
And I am Putri Nurasa Jamila, as the host would like to say, thank you for the nice attention.
Wassalamualaikum warahmatullahi wabarakatuh. For the speaker and lecturers, we hope that they will take a photo together with the audience. For audience,